Hi, it's Patrick Hutzel from Intensive Care at Home, where we provide tailor-made solutions for long-term ventilated adults and children with tracheostomies by improving their quality of life, and where we also provide tailor-made solutions to hospitals and intensive care units to save money and resources whilst providing quality care. In the last blog, I answered a question from one of our readers of our blog, and the question last week was, home before hospital, does it need to be legislated as a right for patients? You can check out last week's episode by clicking on the link below this video. In this week's blog, I want to make a comparison that most long-term ventilated patients and their families can resonate with. So today's blog is about side effects of long-term ventilation at home and in intensive care, or LTAC, which stands for long-term acute care. So anybody who has ever had a loved one in intensive care or long-term acute care, also known as LTAC, on long-term ventilation with tracheostomy knows about the undesired side effects. Intensive care units also know about the side effects of having patients in intensive care that are a slow ventilation and slow tracheostomy wean. Let's just take a patient who has Guillain-Barré syndrome, for example, and therefore requires mechanical ventilation and tracheostomy and a prolonged stay in intensive care for a prolonged ventilation and tracheostomy weaning process. After I have worked in intensive care for over 20 years in 3 different countries, I have seen a few Guillain-Barré syndrome patients that stayed in intensive care for ventilation and tracheostomy weaning for way too long. In this day and age, especially with a successful and proven concept such as intensive care at home, intensive home care would have been a much better alternative when it comes to Guillain-Barré syndrome and tracheostomy and ventilation weaning. So what are the side effects of weaning a Guillain-Barré syndrome patient off the mechanical ventilation and tracheostomy in intensive care as opposed to weaning a Guillain-Barré syndrome patient off mechanical ventilation and tracheostomy at home? Well, I'm glad you've asked. So let's look at the side effects when weaning off mechanical ventilation and tracheostomy in intensive care or ICU with Guillain-Barré syndrome versus weaning off mechanical ventilation and tracheostomy at home with Guillain-Barré syndrome. Let's just quickly look first at what's happening in intensive care. So the major side effect when patients are getting weaned off ventilation with tracheostomy in intensive care, that neither patients nor their families have any quality of life. Patients are stuck in a clinical and sterile environment, and families spend day and night in intensive care unnecessarily to be with their loved one because they could be at home as well. So on the other hand, the major side effects of being at home instead of intensive care with our service intensive care at home is that patients and their families massively improve their quality of life because intensive care at home provides 24 hours a day intensive home care nursing. Therefore, services are being provided where a patient and their families want to be. By having ICU and pediatric ICU nurses coming to your home 24 hours a day, 7 days a week, 365 days a year, patients and their families can relax because ventilation and tracheostomy weaning can be done at home instead of intensive care. Intensive care at home provides a truly holistic environment for patients and their families. So then next, side effects for families in intensive care are they are spending day and night in intensive care or in long-term acute care to be with their loved ones, and they therefore often lose the ability to work and they end up struggling financially. Furthermore, they spend less or no time with other crucial family members, and they may even be far away from home, sometimes hours. Families therefore struggle financially, and they often end up with marital stress, neglect other crucial family members such as their spouse, kids, parents, etc. So let's look at the side effects of having a service like intensive care at home coming to your home when weaning Guillain-Barré syndrome or other long-term ventilated patients with tracheostomy off ventilation at home by having ICU or PICU nurses coming into your home 24 hours a day, where families can relax because they are at home and not in intensive care or ICU, whilst having the ICU skills coming to your home. So that means, in essence, that families can go back to work and support their families. We have plenty of case studies where families were unable to work while they had their loved ones in ICU and pediatric ICU, whereas with our service, intensive care at home, families were able to go back to work supporting their families and earning a wage because their loved ones were taken care of at home instead of intensive care. So let's look at the funding issue. So side effects for funding bodies, healthcare funding bodies when dealing with long-term ventilated patients with tracheostomies in intensive care. So an intensive care bed costs $5,000 to $6,000 per bed day in intensive care, making intensive care bed the most expensive bed in a hospital. So let's look at side effects for healthcare funding bodies when looking after long-term ventilated patients with tracheostomies at home. The cost of an intensive care bed is reduced by 50%, making it a no-brainer. So then let's look at the side effects for intensive care units and hospitals when dealing with long-term ventilated patients with tracheostomies. So bed blocks in intensive care lead to cancellations of surgery, delay in critical care or ICU admissions, bypassing emergency rooms or emergency departments by ambulances, and therefore putting even more pressure and strains on an already overcrowded hospital system. So let's look at the side effects for intensive care units and hospitals when dealing with long-term ventilated patients with tracheostomy, such as Guillain-Barré, at home instead of intensive care. So intensive care at home, when looking after long-term ventilated patients at home, could be Guillain-Barré or anything else, we are actually freeing up intensive care and pediatric intensive care beds, and therefore we make beds available for critically ill patients that can't be home yet. So we are helping to reduce waiting lists for patients in need of a critical care bed. And we are freeing up staff and other resources such as equipment in intensive care. Again, we're providing a win-win situation. The list of side effects when it comes to long-term ventilation and tracheostomy, either at home or in ICU or pediatric ICU, is incomplete, but you get the picture. Whenever intensive care at home services are being provided at home for long-term ventilated adults and children with tracheostomies, everybody is winning, and it therefore is a no-brainer. Thank you for watching. If you want to find out how we can help you to get your loved one out of intensive care, including palliative care or long-term acute care, also out of a nursing home, or if you find that you have insufficient support for your loved one at home on a ventilator, or if you want to know how to get funding for our service, or if you have any other questions, please send me an email to patrick@intensivecareathome.com or call me on one of the numbers on the top of the website. If you email me, it's Patrick, P-A-T-R-I-K, @intensivecareathome.com. Also, have a look at our careers section. We are currently hiring intensive care nurses and pediatric intensive care nurses for clients in the Melbourne metropolitan area, in the northern suburbs, Mornington Peninsula, and in South Gippsland. We are an NDIS, TAC, and DVA approved community service provider in Australia. Also, have a look at our range of full service provisions and our case studies. Thank you for watching. This is Patrick Hutzel from Intensive Care at Home, and I'll see you again next week in another update.